chair does move House File 1379. 1379 be referred to the Committee of Judicial Finance and Civil Law. Representative Baker, before we get started, we're going to adopt the author's amendment. So the chair moves adoption of the A1 amendment. All those in favor say aye. Aye. All those opposed say nay. The motion prevails and the A1 amendment is adopted. Okay, Representative Baker, to your bill as amended.
Thank you, Mr. Chair and members. I was just going to give a quick overview of what the amendment does. It just makes sure it clarifies a couple of exemptions for surgery complications if somebody is given an opioid when they've actually not had the when the surgeon or something didn't see the directive. So I just want to say thank you for that. It is how we want to do it, and that came to us as a request from the Minnesota Medical Association. So we want to make sure it works for everybody. But members, again, House File 1379 is an important bill to me. It's about authorizing and telling your provider, I don't want to have an opioid. It's a directive. And it's just something that goes in as a communication tool into the electronic health records. It's a simple one-page form. Other states are using it. And what it does tell the provider or the EMT, whoever has access to their records, if you're looking at something, there's an accident, there's something happening, oops, okay, this patient has requested not to have any opioids if we can at all avoid this. There's other things they can take instead of an opioid. And my son was a perfect example of this. So I think that what I want to do is the bill establishes a non-opioid directive form. Again, it's simple, easy to fill in. The Department of Health would create the form and make it available to the public online. The form can be revoked at any time. And providers are not liable if they cannot feasibly access the patient's record. If there's an emergency situation or a provider determines in their very best professional judgment that an opioid is medically necessary. The Minnesota Medical Association and the Department of Health have been consulted with this, and they have no issues with this language. A non-opioid directive is a tool to help patients advocate for themselves and can help facilitate this conversation between a patient and their provider by creating a concrete way to begin discussing what can sometimes be a very difficult topic to talk about that carries stigma with your provider. A directive can help create a treatment plan using alternative pain management situations and ensures that a personal, medical, and family reasons for avoiding opioids are respected throughout a patient's care journey. The directive promotes transparency and communication, supporting a safer and more personalized approach to treatment, and has been successfully implemented in 10 other states. I think, members, this is just one small step to have a little tool in the toolbox to make sure that people that are in a journey of sobriety and have fought through this horrible world of trying to get away from these powerful synthetic drugs, this synthetic heroin that is important in medicine, but if it's given out too freely, sometimes with a person who has really been struggling, this could be an enormous trigger if we don't at least do everything we can to let the doctor know. So again, members, that is the bill. I'll have a couple things to say at the end, and I have a testifier here alongside me too, Mr. Chair.
Yeah, thank you, Representative Baker. Just to give members kind of how we're planning to go with this bill to roughly 2:30, so we can take up have 15 minutes for the last bill. And with that said, Ms. House, please state your name and would ask you to keep your testimony down to 3 minutes.
Thank you, Chair. My name is Alicia House. I am the Executive Director of the Steve Rumler Hope Network. It's a nonprofit, for those of you who may not be familiar. It's a nonprofit organization that's dedicated to combating overdose fatalities in Minnesota. For nearly 5 years, I've focused on mission through resource distribution, education, awareness, and advocacy. With years of experience in the field, I've witnessed the devastating effects of opioids on individuals and their families, and I've seen the cycle of suffering and the toll it takes on our communities. This bill is a much-needed step towards empowering patients to make informed decisions about their own care, especially those at risk. And I echo a lot of what Representative Baker had already said, but far too often individuals are being administered opioids for procedures without full knowledge. This is a violation of trust and personal autonomy, and it highlights the need for better safeguards. A patient's right to know what medications are being administered is fundamental to their care. And prior to my current role, I worked for a private provider that supported individuals with severe opioid use disorder in high-intensity residential, outpatient, and sober living settings. I saw clients sent out for dental work, only to return with an opioid prescription in hand. Prescriptions are often given without an understanding of the patient's history or their desire to avoid substances. This can lead to further complications in their recovery, undermining their efforts to break free of their disease. This bill will allow patients the ability to create a non-opioid directive, ensuring that they are not prescribed or administered opioids without their express consent. This empowers individuals, especially those in recovery, to take control of their treatment and avoid being unintentionally exposed to substances that could lead to a return of use or overdose. I strongly urge the committee to support the passage. It offers patients more autonomy over their health care and reinforces our commitment to combating the opioid epidemic with compassion and care. Thank you.
Thank you, Ms. House. Would anyone from the public like to testify? Okay, seeing none. Representative Elkins, you have the floor.
Thank you, Mr. Chair. Just a short question about how this works, Representative. As I understand it, it would be, you would execute this form and it would be uploaded and stored in your electronic health record in much the same fashion as an advanced care directive. And then there would probably be a little flag that would alert a provider to look for it. And then it would be available to anyone who has access to that health record.
Representative Baker.
Mr. Chair, that's right. It's just, it's another tool to have a little tag that says there's a directive here. So yes, correct.
Yeah, no, this is, makes sense and it should be easy to execute.
Okay. Thank you, Representative Elkins. We have Representative Carroll. You are next.
Thank you, Chair, and thank you, Representative Baker, for bringing this, and I appreciate your journey on this issue.
Thank you.
And I feel for you. So my question is regarding the necessity for this. So if you go into your provider and you say, I don't want opioids, shouldn't that be enough?
Representative Baker.
Mr. Chair, it should be, but it's not. And I will tell you a quick example. My wife and I were in the exam room with my son, Dan, trying to get him some relief and planning on the surgery that was coming to try to help his back pain. And so we happened to get a provider we didn't know. It was out of town, or we were in some other location. He was a specialist. He was super cocky, didn't listen to us when we actually asked him with Dan present. Dan is really struggling with opioids. We are trying to get him through this part. Is there any way that we can try to make sure that we minimize or eliminate maybe the use of this at this time? And he looked at us with this horrible grin, and we'll never forget it. It was just this feeling of, you don't know what you're talking about. And again, this was 15 years ago. Yesterday, Dan died 14 years ago yesterday. And so I know it was a year before he passed away. So I clearly remember that. Now, had we, Dan, he was an adult, so he could have put the mandate on his form, and I wouldn't have to have that. It would have been there for him to say. I didn't have to have the look of this. I know better than you do, Mr. Baker. Thank you very much. So we left there feeling very unsure of what we could do. We're not trying to overstep our bounds. I am not a doctor. We're not trying to get any doctor in trouble. 15 years ago, I think they were doing things differently, and today it's different. So this is, I think, just when I saw this bill come up and some discussions that we've had in the past, this is an important part of the step to make sure the providers know it's been thoughtful. It isn't because it's mom and dad, but if the patient wants it there, they should be able to have it. So that's what I've lived through and sort of experienced firsthand in an exam room that did not make it feel like we had a better way to communicate with the provider.
Representative Carroll.
Thank you. Quick follow-up. So I appreciate that. That was 15 years ago. There's a lot more awareness now of the dangers of it, and I think there's a lot of more reticence from the provider community about giving out opioids, and if they do, they severely limit the prescription. I myself have had some orthopedic surgeries, and I don't want the opioids. I don't want them because of the side effects. And there's one in particular that is just awful, and that it has to do with your digestive system. And now I understand why the laxative industry is so huge, and it's no fun. And so I only took it 1 or 2 days just to help, take the edge off. So my question is, my provider was very conscious about that. Aren't the rest of them as well, or most of them?
Representative Baker.
I think, Mr. Chair, I think today you're going to find a lot more of this, much better awareness from our providers and everybody down the chain. It has been a remarkable turnaround for the industry. However, there are still some times where you don't know this and you don't have time to talk to the provider. It might be in the back of an ambulance. It might be an emergency situation. So what we're just trying to do is, if a person really is careful about what is being prescribed to them on any level, whether it's an accident or something down the road or a surgery, upcoming surgery, for your case, they just want to make sure, if I forget to tell somebody, it was in my notes because it's in the directive. So I think it's just an extra step. 1 page gets loaded in, and that's it. It shouldn't be a burden on anybody, because I am one who does not want to make policies and rules more and thicker and harder. But this is important for people that really understand the power of these drugs. And if they're not done in the right way, it can get them into trouble and right back where they were. It can just take one more. And even just getting a script with that 30 opioids, it'll reel them back to, whoa, maybe I should just keep this for another day. And we just don't want to take that. If they really think this through, they just don't want it. But I think this is a simple tool.
Thank you. Thank you.
Okay, members, we have about 9 minutes left on this bill, and we have 3 members with questions. And next is Representative Liebling. Go ahead, please.
Thank you, Mr. Chair. And Representative Baker, I like this idea a lot. I really do. But I have some questions about how it works. And some of that, I'm glad it's going to judiciary, because a lot of it really relates to the liability piece. But let me just ask one question that's just to clarify what you mean by the language. And that is on line 2.30. It's, so this is under the exceptions to compliance. So they need to comply with it except, and then under, so a prescriber, health professional acting on the order of a prescriber may administer it anyway, essentially, if, and so on 2.3, if the patient is being treated in a hospital setting or is being treated in a setting outside a hospital in emergency circumstances. So what I'm not sure about is, are you exempting anybody who's being treated in a hospital? Or is the emergency meant to modify that part of it? I hope you understand my question. So do you mean here to exempt a provider if the patient is being treated in a hospital setting in an emergency, or just being treated in a hospital setting, they don't have to follow it? That's the question, if you understand.
Yeah, Mr.
Representative
Chair.
Baker.
Mr. Chair, I asked Mr. Renner to come up in case I don't answer this right. But I think, as I understand it, a lot of surgeries are planned and they're thought through and everything else, and some are not. I think for me, it's almost any case, whether it's an emergency, if it's a surgery situation, if the provider did not have access to the information that there was a directive on file, in either case, there's no liability to the provider. Did I answer that question, or maybe I'm not getting it to Mr. Renner?
Go ahead,
I don't think I
Mr.
answered the question. I'm sorry.
Mr. Chair and members, Dave Renner with the Minnesota Medical Association. We didn't draft this language, but my read, and I think the intent, Representative Liebling, is that the emergency circumstances should modify both. Because I think it was trying to argue that in those situations where you don't have time to check the medical record, you don't have access to the medical record. That's my understanding, but if others think otherwise, that's why we worked with Representative Baker to put a couple of the other examples or exemptions as well. If you're in the middle of a surgery, this patient doesn't know I don't want them, but you see further complications that in your medical judgment you may need to. So that's the intent, I believe.
Yes, it is.
Okay,
Mr. Chair.
Representative Liebling.
Thank you. Thank you for that. So I think this section, this line 2.30 and line 2.31 needs to be rewritten because it's really not clear. It looks like you're trying to exempt anything that happens in a hospital. And I think what you're trying to exempt is something that happens in an emergency, whether in a hospital or not, where you can't access the records. And I think it sort of says that elsewhere, so maybe you don't need that line at all. Anyway, thank you.
Okay, thank you. We are on to Representative Bonner.
Thank you, Mr. Chair, and thank you, Representative Baker. As the daughter of a nurse who believes heavily in medical directives, I actually say thank you for this bill. I think it's a good bill. I think it's a good tool in the toolbox. And quite frankly, we would love to think that our providers will listen. But there are circumstances in which, if someone's unconscious, if they're in an ambulance, something like that, if we're able to access those medical records and have access to that information, that's a huge tool for the folks taking care of that patient. And the reality is that you are your own best patient advocate, period, the end, right? And so having the ability to have this tool on file that really spells out clearly what your wishes are with regards to pain management, I think it makes a big difference. And for folks like your son who may be struggling, or even if you're just nervous because you have someone in your family who has struggled, I think this makes a significant improvement in being able to have that available. I will tell you openly, I would plan to sign on to this bill in support of it. I really appreciate this bill. I do hope that we can clarify that language just a little bit on the when you can't access the medical records, because I understand what you're doing, and including the line in the amendment on 1.6 that kind of adds that additional clarification about not having access. But yes, any way we can make it as crystal clear as possible and in plain language is great. But I like the bill, and I appreciate you bringing it forward.
Thank you.
Okay, Representative Bierman, our final
Thank you, Chair Becker.
questions.
Thank you, Representative Baker, for bringing this bill forward. I liked it the minute I saw it, and I really appreciate your work on it and bringing it forward. I think it's a commendable piece of legislation that will help a lot of people. I did have one question, and that is, how does it relate, or what would be the process if do you have to take a separate document to your dentist to make sure that you're covered in that clinic, probably, I would imagine?
Representative Baker.
Boy, that is a very good question, Mr. Chairman. We are going to find out. So this form is going to be uploaded with the Minnesota Department of Health. That's what it's going to be under. But when it reaches over to other providers and other industries, we want to make sure we have more eyes on it. So Representative Bierman, like Representative Liebling, we have a little bit of tweaking to do here. Let's make sure we get that right. I will tell you again, 10 years ago, or maybe 8 years ago when I was here, the friends of ours from the Minnesota Dental Association were the first ones who came to me and said, we need a bill that lessens the way we prescribe, because they knew that they were overprescribing. So I know our dental association friends will be all on board. If there's a way for them to see that as well, that'd be great. So thank you for that, Representative Bierman. I'll make sure that that also gets included so there's clarity at the next stop at the next committee.
Okay,
Thank you,
follow-up?
Chair Becker.
Representative
and,
Bierman.
Yep, we'll get it through judiciary and get it back here and get it over the finish line. Thank you.
Okay, thank you, members. Seeing no further discussion, Representative Baker, please close on your bill.
Yeah, thank you again, members, Mr. Chair, for the good discussion. That's what the committee process is for, is to make sure we don't miss anything. And we will just tweak a few things. This is important stuff. I miss you all, by the way, because I'm not in Health and Human Services anymore. But I just know the depth of your work here, and I'm grateful for it. Thank you for listening to Mr. Drucker earlier today. We worked together a lot on different things. And again, this is an important part of this process of making sure Minnesotans, when they need to come close to an opioid for medical reasons, and there's a very important reason why this is still here in medicine. We just got to make sure the tools are there to help you guys out. So thank you very much, members, and Mr. Chair.
Thank you, thank you. The chair renews his motion that House File 1379 as amended be referred to the Committee of Judicial Finance and Civil Law. All those in favor say aye. Aye. All those opposed say nay. The motion prevails, and House File 1379, as amended, is adopted. And be headed over to judicial. Thank you.